unexpectedly. And it ended up being twins, which was even more of a surprise. I had an extremely difficult pregnancy. I had high blood pressure. I developed toxemia, preeclampsia.
Yeah, just a few of the complications. Beyonce opening up about her difficult pregnancy in the Netflix concert film Homecoming. While pregnancy can be risky for any woman, according to the CDC, black women are about 3 times more likely to die from a pregnancy-related cause than white women.
Well, OBGYN Dr. Courtney Pouchet is here to review some of the serious pregnancy complications that Serena Williams faced, Beyonce, and others, and what tips you can learn at home.
Yeah.
So let's talk about high-risk pregnancy. Who's susceptible?
So any woman over the age of 35 is automatically considered a high-risk pregnancy.
Wow.
In addition to that, any woman who has any pre-existing illnesses, such as high blood pressure going into the pregnancy, puts them at even higher risk. Having a previous C-section also puts them at high risk. And unfortunately, just being African-American triples your risk of maternal death.
Now, when we talk about just being African-American, are we talking about socioeconomic here? Are we talking about DNA, blood? Are we, like, what do you mean about African-Americans?
So it's basically across the board, and we haven't teased out all the details, but clearly we were just talking about Beyonce, who's in an upper socioeconomic status, still hit with preeclampsia. So it's for everyone. There are some contributing factors, though. If you are in a lower socioeconomic status and you have less access to health care, that can be worse off for you.
Yeah.
But just purely genetically, it seems as though African-American women are unfortunately more susceptible.
Wow.
Was Meghan Markle, was her pregnancy considered high risk?
Because she is over the age of 35, her pregnancy is considered high risk.
Wow.
Wow.
That seems so young nowadays, right?
Right. And, you know, that's one of the trends that's happened is that women are delaying pregnancy, so many more women are falling into that high-risk category, and that could be contributing to our increase in our maternal death rate.
Jeez. So to be honest, I think about high-risk pregnancy. I don't think about Meghan Markle. I think about Amy Schumer. You know what I mean? And so to hear African-American women are more at risk 3 times, that's a very scary number. It's
a very scary number. And it's not just for the preeclampsia that you heard about, but it's from the #1 complication, which would be hemorrhaging, bleeding during your pregnancy death.
We have Serena Williams up right here. Well, here's one of the most powerful women on the planet.
Yeah.
Right.
What went wrong with her pregnancy?
Well, unfortunately for Serena, who I did not treat, but from what we've learned from her is that she already had a pre-existing illness. So like I mentioned, if you have an issue before you're pregnant, you're at an even higher risk. So she had had that issue of having a pulmonary embolism, which is a blood clot in her lung, long before she was ever pregnant.
Yeah.
So then you add pregnancy to it and all those hormones, your risk for that goes up tremendously. And unfortunately, that's what happened to her again. The best thing, though, for her is that she was an advocate for herself. She saved her own life.
You have to listen to that, everybody. They're not just women, but men. Listen to your body. We hear this over and over. Kim Kardashian, major complications going back to baby West.
Yes, and I have memories of having to do the same thing that she went through with patients that I've had. So she had that issue of hemorrhaging. She definitely could have died. Again, I didn't treat her, but she was very descriptive as to what happened with her in her delivery, and the placenta got stuck. It's called placenta accreta. So it grew abnormally into the wall of her uterus. It's supposed to just come out super easy, no big deal. Well, hers got stuck. So her doctor had to basically insert his entire arm up and into her body and scrape the placenta off of her uterine wall.
I know. And, you know, and now she's thinking baby number 5. I like that it's opened up. There's all different ways with surrogacy and everything that women can continue to go through that, watching what she went through with West.
What is happening, though, as these women and the people that we all admire are being more vocal about the complications that they're having, about the true experience of their pregnancy? What is that doing for the culture shift?
Absolutely. My hats go off to all of these women who are bringing all of these women health issues to the forefront, letting women know, hey, guys, childbirth is not easy, right? And to that note, I think it was great that Meghan Markle ended up delivering in a hospital because it's not easy and things can happen at the drop of a dime.
It's not all this Instagram-worthy situation.
All right, we got Dr. Pouchet here. Yeah, give us 3 tips for all women out there to try to have a healthy pregnancy.
Absolutely. Be your own advocate, just like Serena did. Pay attention to any symptoms that you're having. And I think more than that, consider preconception counseling. You know, people talk about, oh, we planned our pregnancy. That just meant we decided to have a baby.
Right.
How about go in, talk to your doctor, and see what those risks of the pregnancy are going to be for your specific situation.
And what your options are.
Great. Is Dr. Pouchet. I love your name, too.
You've done it again.
You've done it again, Dr. Pouchet.